Becky. Welcome to 4 North. I'm going to do a floor orientation for you of 4 North Pediatrics. So follow me along and I'll show you all about 4 North. Okay, we are a 22 bed unit, but we currently are capped at 8 beds, depending on how many staffing we have and the needs that are happening at the time. This is one of our rooms. We use this room. You can go ahead and look at it. This is an infusion room. So why don't you come on in here with me and I'll show you a few things about it. When you come into your patient's room, we want you to greet your patient, obviously, check their ID band, but some of the important things that you can check before they're even awake, if you want to come a little closer. You want to check your emergency equipment, so on the wall you want to make sure you have high flow oxygen, up to 10 to 15 liters with a Christmas tree on the bottom, and you want to make sure that your suction is actually working. Sometimes you have to push it all the way in to make sure it clicks, and that you have the correct setup. Behind each bed over here in the basket, there should be your safety equipment that you need, like your oxygen, your suction, blood pressure cuffs, anything that you should need for your patient. In these folders, we put the emergency drug sheets and the pediatric resuscitation sheets. They're based off of each patient's age. We have the ambu bags for each patient size, so you just want to make sure that this didn't get taken with somebody in transport, so make sure you have the right size and then that it has the correct mask inside of it. Okay, this is the locked door, so anytime somebody leaves they need to be let out. The light will turn green. It used to turn green up there. Hopefully they'll get that fixed for us, but they just have to push really hard. It's locked to go out but not locked to come in. If you want to come this way, I'll just show you. This is the family lounge, so families can hang out in there if they have a big meeting, or this is where we have our ward meetings as well. There's a few toys in there for kids to play with and a large TV for watching a football game or something. Let's see, so the 22 bed unit, you can walk this way and I'll show you. This is our NCO ICU's room, so they do all of our time cards and our staffing stuff, and if the equipment, if they have any issues, you can stop and ask them there. This is the resident sleep room. If you're pumping, you can also pump in this room. And then if you want to go this way, we'll introduce you to Sergeant Hecker. Hi, Sergeant Hecker. Are you cleaning the floor?
I am. That's what I do. I thought you knew.
Cabinet by the bedside, there's these PPE bins, so it has all your equipment for self-protection. And then these should be stocked with like your linens and some quick grab stuff for each patient. If you want to come down here, we have some that aren't labeled for that. Your fire extinguisher is here and down by Miss Moxley or the head nurse's office as well. If you come this way, we've got our Omnicell room, and then here's where a lot of our like pajamas and gowns and robes are. Come this way. And these are the little kid PJs right there, and then we have the infant shirts. There's also some donated items that we're not supposed to be accepting donated items, but they are down here, and they're for like our foster care kids. And there's also some hats that are knitted that we get from the NICU. There's the other fire extinguisher right here. This is Miss Moxley's office, or our assistant head nurse, and then our head nurse, we're kind of in the interim right now. If you want to come on over this way, we have our beads for laps, so kids can walk around and do laps and they get beads, and then if they do 5 laps they get to pick a special bead. Over in this room is our doctor attending office, so we have a hospitalist that's available at all times to us up on pediatrics. So currently right now we have Dr. DeLeonidas, Dr. Berger, and Dr. Heckler, and they are in this room. And then the residence room is back this way. The scrubs for staff or residents are back here. This is the resident workroom. It's really nice on 4 North because we have residents available to us 24 hours a day. You can come back and ask them if they're on the pediatric team. If there was an emergency, they're available to grab at any time for any pediatric emergency. Right this way. This is our clean utility room. Hi guys. I'm going to sneak in here real quick. It's kind of disorganized right now, but we're getting new IV pumps. Over in the corner over here is all the wires and stuff for each room. And then this is also where you'd find commodes, moving equipment, IV poles, and PCAs. Room 483 is our only room that has the Hoyer lift in it, so if we have a patient that needs help getting up or is larger than our normal pediatric population, we can use the lift there. They do have lift, the connections in here for lifting patients. This is a slide board. It's got the plastic to use to cover it when we move patients from room to room. There's also slide boards over by the trays that can help you move your patients safely. I'm going to come this way. This is room 477. We have a patient in there right now just for a long-term stay. We use this room for multiple reasons. We use it for end-of-life care. We use it for patients that are here for longer than just a couple of weeks. It has a parent bed and it also has a patient bed. The parent bed has special linens that they're blue. This is a room that we're not allowed to sleep in. We've had some staff being found sleeping in there watching TV. I'm not sure if it's doctors or nurses, but just know that that's a big no-no. According to Sergeant Hecker, you'd be in big trouble. So, but the room is kind of set up the same way. We can put in a bed or a crib, but we try to make it nice for the family. There's a printer, there's coffee, there's a little fridge in there that they're welcome to use, and then there's some other things that would go along with that, with the end-of-life book that you can use if that's what they're here for. This is our toy room. It has to have the patient has to have family accompany them in here, and they're supposed to clean up after themselves, but there is also over in the closet over here is the art closet. I wish I had the key to show you right now, but it is something that anybody can pull out. It's on the white stick key, and anybody can do crafts. If you have less patients, somebody could be assigned to doing the craft job that day. That would be really fun. All right, a few more things to tell you. The housekeeping closet is here. It's always locked.
Unless I'm here.
Unless you're here, and then that's where the toilet paper would be if there is toilet paper. We have 3 rooms here that are double doors, so there are isolation rooms, and every room on 4 North can be made into an isolation room, but these ones are specific for negative airflow. There's 2 rooms that have negative airflow, and then 3 rooms that are double doored. So basically, if it's a negative pressure room, you would have to make sure both doors are closed for it to be functional, and then the light would be green out here. The emergency ambu bags for these rooms are in the interim room. You can come in here to get dressed, or we've now been restocking them on the outside as well. Okay, so here's all your stuff. Let's see, a few more things. This is the nurse's station. Back here is the nursing room, and there's lots of food in here for purchase. So it's an honor system to put in the jar above the refrigerator. But this is where all the nurses like kind of check in and have their mailboxes. Okay, right this way. This over here is our like food area and storage area, so really nothing should be in the hallways unless it's on the horizontal way. If it's in the hallways, it needs to be moved out. But this stuff is okay here because it's in a little nook. Trays are here, there's high chairs in the back, and then this is where we would keep wheelchairs. These strollers are available for use. We usually recommend putting down like a blanket or some kind of protective layer between the patients, and we can take them off and wash them, but it is very challenging. And then over here, we have our crash carts. So on pediatrics, we have 2 crash carts. We have the peds crash cart and the adult crash cart. If there is a code, we want you to grab both of the carts. But this is what the emergency drug sheet is for. So up above on the emergency drug sheet, it should say what color they are. That's the Brassel scale. And this is your carts that you would bring to an emergency. This is the staff bathroom. In the back and behind the other double doors, there is 2 locker rooms for staff to change into, and those have bathrooms in them as well. This is our nutrition center. It's kind of loud in here, but one of the things that it has is information for the parents on the hours for different food that's open in the facility. So we've got, right now we've got Subway and Einstein's, and there's like a little sushi place down there, and that's open longer hours than the DFAC. And then the DFAC has strict hours that they're open. So families can leave their food in these fridges. They just have to label them and date them. There's stuff in the freezer and snacks, and then silverware and water. And the breast milk fridge is here as well. This is the back Omnicell room, if you want to come in here. This is also our treatment room. So this is where we do procedures on our children. If we can try to not do it in their beds, that is ideal. Sometimes being in isolation, that doesn't work so well. But a lot of our IVs are done in here. This is also the respiratory closet for our respiratory therapist. So if there's a few things that you're missing that you're not sure of, you can look here. It goes like that. If you have a patient in here for an LP or a procedure, you should try to have them on the monitor. Just be aware of what the settings are that you set. This is the dirty utility room. It's the favorite room. It smells so wonderful. So basically we weigh our diapers, we zero them out, we grab the same size as the patient, and then we can weigh the amount. It'll be in cc's, grams and cc's will be equivalent. But that's really all that gets put in this room. When you get a discharge, you can put your leftover cuffs in the blue bin here, and then the biohazard is here. If you have a 24-hour urine or something that you have to refrigerate that's soiled, like stool, it would go in this refrigerator back here. If something is chemo hot, we have this sign on the door or the items that we're worried about that are chemo hot. If you come this way, we can maybe take a little break in our wonderful break room. Sound like Vanna now, right? This is our break room. This is where we usually have lunch. Staff can put their stuff in the fridge. There is a TV to watch and a microwave. If you come over here behind you in 461, this is our rooming in room for our NICU moms. So they board here and then their babies are in the NICU. They can pump and they get a tray here. And they can kind of live here while their babies are in the NICU. And then if you want to come this way, this is our storage area. We have donated toys that we get mostly once a year around the holiday that we put into separate little bins. If you look over here, we can pick any of this stuff out for our patients to keep them busy. There's some books here. If you want to use a reward chart for them taking their meds, you can do something like that and have them come pick it out. There's also media devices back here for allowing them to watch things. They can also plug in a lot of the stuff to their actual new TVs that they have in their room. And then we've got the DVDs and the game systems here. Okay, I hope you had a good time learning about 4 North and you got all your questions answered. Please feel free to ask anybody if you have any questions about where things are or how we do things. Everything changes on a regular basis here, so there's always new things to learn and new ways of doing things. Thanks and have a great day. Please watch our other videos so that you can learn about our Omnicell room and some of the other things that we do here on 4 North.
Go.
I hope you had a good time learning all about 4 North, and if you have any questions, please feel free to ask anybody that, oh, that's terrible.
Go.
Please feel free to grab anybody, and your charge nurse is always the best resource, or our head nurse. I don't like that either. Hope you had a good time learning all about 4 North. There's lots of information to know, so just grab a local, oh God, we'll have information on it. There's lots of information here. Things change constantly around here as far as, oh, I don't know, that's not good.